become the first European nation to ban the use of the AstraZeneca coronavirus vaccine. The country's health officials have told the media that they'll be banning AstraZeneca. This as the WHO and also the European Medicine Authority have assured the benefits of the jab still outweigh its risks and have advised nations to keep using it. Now, Denmark happens to be the first nation in Europe to suspend the use of AstraZeneca jab in its vaccination rollout after reports of rare but serious cases of blood clotting and amongst those who had received the vaccine. More than a dozen countries followed suit, but a few have since resumed the use of the European Medicines Agency after it emphasized about the benefits of the vaccine and deemed it to be safe and effective. Denmark had, however, continued to hold off using the vaccine as it had conducted investigations of its own in the country of just about 5.8 million inhabitants. 8% of the people have been fully vaccinated against COVID-19 and 17% have received the first dose of the vaccine. Since the suspension of the use of AstraZeneca's jab in the month of March, Denmark has continued with the use of Pfizer, BioNTech and Moderna jabs. But the EU member nations, such as France, have said that they'll be sticking to the plan of using the AstraZeneca vaccine. The French government has said that it has confidence in the AstraZeneca vaccine as an essential tool in fighting the COVID-19 infection. And the decision, of course, comes as Germany has announced that people under the age of 60 who had received the first dose of the AstraZeneca jab will receive a different vaccine for their second dose. The EMA has recommended AstraZeneca vaccine, saying that the benefits outweigh the risks, but several EU nations have limited its use to certain age groups.
South Korea's mass immunization campaign is picking up pace amid safety concerns. While no direct link is found, 3 more post-vaccination deaths reported, all of them from AstraZeneca's. Authorities are following up with meticulous investigations. In Germany, there's a changing stance on the AstraZeneca vaccine, allowing over 65s to receive the jab, claiming recent studies provided enough data. Kim Da-mi has our top story.
3 more AstraZeneca vaccine recipients died on Thursday. 2 were in their 50s and 1 was in their 20s. Both of those in their 50s were patients at nursing hospitals in Jeollabuk-do province and had underlying conditions, cardiovascular disease and diabetes. While the first patient died 2 days after getting the shot, the second person died just 1 day after. The person in their 20s who suffered from epilepsy died at a nursing hospital in the city of Daejeon 2 days after being given the shot. That brings the country's total vaccine deaths to 5. While health authorities believe there is no causal effect, the country's prime minister has vowed for a full investigation.
The government will thoroughly investigate the deaths and openly share the results. So please believe in the government and get your vaccine shots.
515 new cases of AstraZeneca vaccine side effects were filed on Thursday, raising the total to 722. But the country's nationwide vaccination program continues, with patients and medical staff at hospitals designated by the health ministry to treat people in critical condition. The president of Seoul National University Hospital, Kim Hyun-soo, who got the hospital's very first jab, reassures people that there is no reason to be particularly concerned. Meanwhile, COVID-19 variant cases continue to pop up, though most are being identified in people arriving from overseas. The country added 6 more variant cases on Thursday, 5 from abroad and 1 domestic infection, making a total of 162. Kim Da-mi, Arirang News.